This week's Coming of Age episode is sponsored by OLTCA's sector champion, Plan A, powered by StaffStat. It's through their ongoing partnership and generous support that we are able to host our thought-provoking podcast. Stay tuned to the end of today's episode to learn more about Plan A, powered by StaffStat.
What gets me out of bed in the morning, and I believe this is true for all of us at peopleCare, what gets us up in the morning is changing the world of senior living. And that's what we want to do, and get up every morning and make an impact.
This is Coming of Age, Meeting the Needs of Our Aging Population, a podcast about how we can better support our seniors. I'm your host, Donna Duncan. I am also the CEO of the Ontario Long-Term Care Association, which represents about 70% of long-term care homes in Ontario, Canada. In this episode, I'm joined by Brent Gingerich, Chairman and CEO of peopleCare Communities. Brent stepped up to serve as chair of our Ontario Long-Term Care Association board at the height of the pandemic. He's a highly regarded leader in the sector and is known for his values-based leadership throughout the most difficult of times. I must say it was a privilege to work with him in supporting teams in their homes to bring everyone along at what was a truly unimaginable time. No one left behind is his motto. Brent quite literally grew up in long-term care in a family deeply committed to public service, especially to seniors. In our discussion, Brent shares his beliefs on how to create great places for seniors to live and how to create meaningful, purposeful places for people to work. I am absolutely delighted to welcome today a very special guest and a very special leader, Brent Gingerich, Chairman and CEO of peopleCare Communities. Welcome, Brent, to the podcast. Really excited to have you join us.
Thank you so much, Donna. Thank you very much for having me. It's a real pleasure. Been enjoying this podcast since it's been kicked off. So it's fantastic to be part of it.
In addition to his role with peopleCare, Brent has been an extraordinary strength and stay for the association throughout the pandemic as chair of our board. And really do want to thank you for your leadership, Brent, both within your own organization, but really your philosophy of no one left behind, building strong, high-performing teams really has resonated and helped to lift hundreds of long-term care homes and their teams up during the worst of our experience with this global pandemic. So thank you very much for that. You bring a very special approach to how you lead, at both from your own organizational perspective, but also from a system perspective, but also from a social perspective. Brent, you refer to yourself as a social entrepreneur and an impact investor. Could you take a moment and explain what that means for the benefit of our listeners? And then how does that translate into practice on the ground?
Well, thanks, Donna. Thanks for that very kind introduction. Really, I'm interested in applying organizational best practices to solve social issues. You know, it's been an honor leading peopleCare. Our vision is really to change the world of senior living. And this we try to do by making and focusing on making a positive impact in other people's lives and the sector's evolution. Yeah, we want to make a positive impact in our communities and a positive impact with everyone touched by our services. And this is something that has been a value of our organization and my family's for ever since I really can remember.
So that taste for community social enterprise really was endowed to you at birth. It's part of your DNA.
I guess so. I mean, peopleCare was founded by my grandparents, Ruth and Roy Schlegel, over 50 years ago. You know, they would sponsor displaced people, at the end of the war, World War II, helping people come to Canada, supporting destitute individuals and providing accommodation in their own home. The house was always very busy, lots of activity. It was always open and welcome for people to come and go. And Eventually, they found their way to found a home for special care, as it was called, at an old schoolhouse in Tavistock, where in fact they actually lived out of for a while, and that evolved into a long-term care home in the early 70s. When I came along, so I was really born into long-term care. I remember, my parents actually ran the home for some time. Literally, they'd bring me to work for babysitting, and I would just kind of run around the home, my brother and I, and we'd follow whatever staff member intrigued us that day, whether it was the maintenance person or whatever. And it was really, really fun environment, and that sense of caring and community. I guess we were just born around. Those values, I guess, stuck with me. And, I'd worked in the home during the high school and part-time, and obviously throughout my childhood. But after high school, my friend and I decided to take a gap year, and we had a bit of a sense of adventure and traveled to Bangladesh, of all places, which is the place he was actually adopted from as a child, and worked at an orphanage there for some time, and then traveled around Southeast and Southwest Asia, and really realized how fortunate we are in Canada, and how most parts of the world does not have the social safety net that Canada has, and I came home with a real clear sense, I think, of purpose and what I would dedicate my career toward.
Well, and I know that through your leadership, peopleCare Communities has partnered with MEDA to invest for social impact. And so interesting to hear the roots of this partnership. How did that relationship come to pass?
Yeah, I think MEDA is Mennonite Economic Development Associates, and obviously it was originally kind of a faith-based organization organized by Mennonite entrepreneurs to help foster economic development in developing countries. This carries on today. MEDA has 25 or so projects going on around the world, really creating economic development opportunities for individuals, primarily now women and girls, to provide meaningful work and entrepreneurial opportunities, which can lift the entire community. And without that economic development, there's no social programs, there's no social safety net, there's no schools, there's no wells. So it's really kind of a game-changing philosophy, and we're part of this UN pledge to try to end extreme poverty by 2040. So it's exciting to be involved in that. I'm now on the board of directors. After leaving old TCA's board, I've been excited to join MEDA and focus on another compelling opportunity.
Well, and it does speak to your values-based leadership as well, Brent, and that really comes out. As I think about peopleCare, and I've been to some of your long-term care homes and know so many of your team members, you are known to have a dynamic culture of excellence, innovation, engagement. Your team members are really engaged. What's the secret sauce to fostering that kind of culture?
Well, I think you said it right there. All I can do as a leader, and all we can do as leaders, is try to foster a culture. Foster a culture of high performance is what I strive to do. We strive to do at peopleCare. You got to create the right environment, so great things can happen. The magic really happens in our home, but here as health leaders, all we can do is try to foster that culture and have a compelling vision. First things you need to do is, number one, define what high performance culture is, and number two, you try to live it. So to define it, have your compelling mission, vision, and values, and these have been fortunately with peopleCare, passed on generations, and really makes us who we are. From there, you need to define your key success factors. What are those really key, compelling, game-changing things that we want to rally around and monitor and focus on as an organization, and obviously quality service is very important. Leadership is very important. Financial stewardship is obviously very important when you're operating a large organization. quality service in our organization is very easily defined to be exceeding the expectations of our clients. And we define clients as residents, families, staff, and anyone touched by our services. So we're always striving to meet and exceed expectations. And that's the simple measure of quality. There's other clinical indicators, obviously, we monitor, but it doesn't have to be more complicated than that.
We've been through a lot, and your teams have been through a lot, and our local communities have been through a lot as we move through the pandemic. And unfortunately, there's a lot of stigma around long-term care. And a lot of, quite honestly, we've spoken on this podcast a lot about ageism. How do we get out ahead of this stigma?
What we try to do and what we want to do is establish a high bar. And how we establish a high bar is inspire people, is try to be innovative and go beyond the status quo. That is what gets us up in the morning. That's what wakes us up. I think there's some organizational best practices that can be garnered, and they're really not that complicated. I think from a policy and government perspective, it's realizing that, I think we've made some tremendous progress. The pandemic has really been a difficult time and taken its toll, but it has shined a light on senior living and senior care and some of the issues that we've been facing and advocating for over since my entire career. The government is, I think, keenly interested in making positive change. And we have, I think, a responsibility as operators and leaders to help inform that change and make sure our emphasis are on the best means possible. Our policymakers and government are huge leaders in this sector. I think there's some organizational and best practices that can be applied. Number one, let's create a compelling vision and mission for senior care in Canada, in Ontario. The National Health Service of the UK has a very compelling mission and vision for guiding their program. And, it's around improving lives and striving to improve health and well-being and people's experience in the National Health Service. And again, speaks to, how I define quality very simply is exceeding our residents and families' expectations. And, I think garnering that vision, rally behind it, and then agree on, what the key success factors and the key measures are. And certainly that's a key one of them. And instead of, focusing on, inputs and such, we look at outcomes and really let our caregivers do what they love to do, and that's provide care. And that's what really inspires people, I believe, and inspires our caregivers.
I know that you've done a lot with your team around the resident and family satisfaction. So if one of the biggest measures is whether our family members and our residents are satisfied, if they're happy and feel valued and well cared for, then that's really one of the most important things that matters, and they feel safe. I know you've done a lot of work with your team around gauging the satisfaction. Can you speak a bit about how do you bring those voices to life, and how you engage with your residents and families, and what you do with what you learn from them?
You got to really understand, what our caregivers are, what's important to our caregivers, and they're the ones that are on the ground and making the magic happen in the home. If we have engaged caregiving teams, and then that's the best thing we can do to provide high levels of quality and care to our residents. That's really what is important to them. We have surveys and engagements all the time in our homes. What's really important to our families and our residents are our staff. We're building these new, beautiful homes, and there's all kinds of, there's older homes out there, there's newer homes, but really what's most important to our residents and families is those team members that are providing that care. I remember when I was a student, working in long-term care, I think one of my first days on the floor, I worked in activities. I came to work the first day and I was, kind of well dressed. I wanted to make a good impression. I had dress shoes on and one of our nurse leaders looked at me and she was very close to our family and had been friends with our family for years. And she looks at me, she goes, Brent, dress shoes aren't going to work. I'm like, what? You'll find out. So after my shift, you run your tail off the entire time and probably had blisters at the end of my shift. So that's long-term care. I mean, you come to work, you put your running shoes on and you run hard, but at the end of it, I just felt incredibly satisfied, at the end of my shifts. And that's really what kept us going. So, I think our job as leaders is to, remove those barriers for our caregivers so that they can focus on, what's important to them. And, I see my role as a leader is to, provide the tools and the resources that they need to do their job. Advocate. And again, another reason why I stepped up on the Long-Term Care Association board to again, try to get the resources that we need so our caregivers can do the jobs that they love to do.
Well, and as you know, what we experienced through the pandemic, there was such a focus on numbers, on data throughout the pandemic, and everyone was counting numbers, the number of deaths, number of people, number of homes in outbreak, number of people who'd been infected by COVID. And at the end of the day, this is about people. It's the people who are living in the homes, the people who are working beside them, and the people who are visiting them, and keeping those individuals at the core of all that you do really resonates.
Yeah, I mean, the pandemic really took its toll. I mean, it was a really difficult time. I remember, Donna, you and I working together, and man, thank you for everything that you've done in keeping the sector aligned and advocating for resources that we need. It's one of the most difficult things we ever faced. I think this pandemic, and we're still going through it. But we'll get together, and I think one of the best thing we did was we tried to stay grounded. We tried to stay grounded in our values and really trying to help others. So I think that's what helped me is to try to help others and help the sector. Remember, our motto, Donna, was that no one gets left behind, and it was just I don't know. Hopefully, it resonated, continues to resonate. But I think if we stay grounded in what we're all trying to achieve, when chaos is ensuing, and continue to provide create innovative solutions to those problems and put those things forward, we can't work the same way we've done in the past, right? Things have changed on the dime. COVID threw us a curveball, and we have to pivot and continue to be innovative and try to drive different solutions to these unique problems that we're now faced with.
So to that point, Brent, we really did come together as a sector, not only across Ontario, but across Canada and around the world, and comparing notes with colleagues in the United Kingdom or Australia or from Vancouver really, really helped. And even our weekly members calls, and we've had hundreds of people coming each week to share and to come together. One of the risks I think we have is fatigue and burnout now. And a lot of our leaders are feeling less resilient. Health Human Resources is the challenge plaguing all of us, again, regardless of country, regardless of community. How do we support individuals in anchoring themselves in a more resilient framework? How do we give people hope? How do we keep people engaged? And how do we keep people working together? As fear sets in and fatigue, it can become very oppositional. And we really need leaders. We need to support the leaders we have. And we need leaders like you to help lift up those who are still working in this sector, but also demonstrate that we've got the leaders that people want to come and work with. How do we get some positive energy and overcome some of the darkness, but create some momentum that's positive and encourages everybody to move on that path to innovation, to modernization, to see this as a really motivating time?
And I think it is. I mean, it actually, one of the things that inspired me to be chair of the OLTCA was that I think this is one of those unique events that will drive real change and shine a real light on seniors and issues and aging and ageism. We have a great opportunity to reshape things, but burnout's also an issue, right? So we need to acknowledge that our caregivers can't do everything. We need to support them, and we need to be there for them and acknowledge the great work that they're doing. Build strategies around, peopleCare calls our strategy Recovering Strong. This is a wellness initiative, and we have wellness champions in each home and on each floor, and just again trying to get a pulse for our staff, and that we don't we acknowledge burnout is an issue, as we staff are working short out there and doing double duty, and there's all kinds of disruption. So again, one of the more disheartening aspects was that our residents became isolated, and our families had trouble visiting, and we tried to prevent COVID from coming into our homes. It was a difficult time, and again, we need to look outside the box and look at some innovations and look beyond long-term care. I remember during the pandemic, we brought in Doctors Without Borders, and they were doing. Thankfully, they were doing some outreach in Canada. Doctors Without Borders, they recognized this was a crisis, and they brought some resources to the healthcare system in Canada. We brought in some nurses who had been involved with the Ebola crisis, in Africa, caring through that, and we had them speak with our team, and I believe that inspired some chats with the entire sector. It's just our nurses are trained to work in an environment of infection control. As long as they have the tools and resources to do that, they can do that. But certainly it's bringing new innovations to bear, like testing. I remember. We recognized testing was a real problem. And this was, but with good testing, we could keep COVID out of our homes. And peopleCare, I think, was instrumental in pushing rapid testing into the sector. It's certainly not perfect, but it's a measure. It's something that can help bringing more innovations like that. And I think we also have to look at how we can be more productive, and how our caregivers can do more out there, and not burden them with some of the admin activities that they have to do, and let them focus on residents and caring, and let us administrators worry about the other parts of it. And we have technology that we can use to support them on those things as well. So I think there's really exciting times in this sector. I think long-term care is a great place to work. It's super satisfying. I really see some great momentum, actually, and a real shift.
I know you've really pushed the envelope on a number of occasions, including with pharmacy, long-term care pharmacy, specialized pharmacy for our long-term care homes built around the needs of who our residents are, but also supporting staff teams, given the medication requirements of our residents, the leadership that you demonstrated on rapid testing. And I think you've demonstrated that if you go with a solution, government is open. I think there is an opportunity for some more nimbleness. We've got about 40,000 people on our wait list today in Ontario, and 3,000 of those individuals are in crisis. We know that our hospitals are struggling. Primary care, family health teams, the system's at a very critical point. But at the core of this is that the number of individuals in Ontario alone over the age of 80 will double in over the next 13 to 15 years. We have to continue to get government support in long-term care. What are your recommendations as policymakers and decision makers contemplate the future of long-term care within that broader context?
The government's made some tremendous progress and has some tremendous opportunities to improve senior living in Canada. I think the key role is fostering that culture. Foster a culture of high performance. You can't force a culture of high performance, right? We've often talked about, and there's been many reports on this culture of compliance and policing, and is really counterproductive. It actually de-inspires and demotivates our caregiving teams out there. So we need to create a culture of high performance. And how do we do that is through engagement and really talking to the operators, talking with our caregivers, and figuring out what the tools and resources they need are to do their job. Monitor outcomes. Monitoring outcomes can be actually motivating for people. It's establishing a target. Let's say it's exceeding expectations of our clients and families, and we don't have a common measure of that even now. Right? We don't know what the baseline is. It's funny. We have all these complicated clinical metrics, and you can go online and check them out, and great clinical indicators, but they're not really necessarily what's ultimately important to improving the experience of our residents and families. It's fostering a culture as opposed to forcing a culture, right? You can't force anything. We need to foster. So let's step back and have a dialogue on how we can do that.
As you engage locally, what are the things that you hear from the people in your communities about the value of how you build your homes, how you support your residents and engage caregivers?
We do a lot of engagement. So, when we've been fortunate to have the opportunity to grow and peopleCare and have the opportunity to redevelop our older homes and develop some new homes. And, the first thing we'll do is engage with the local governments, municipal governments, and local community groups. Engagement's very important. People are really thrilled for the opportunity to create real senior living communities, places of care. At the end of the day, people don't want to live in a facility, right? People want to live in a home. And beyond that, people want to live in a community, right? There's a lot of social isolation among seniors, out there. And it's important to build that community. So that's what peopleCare tries to do, is we try to create communities, caring communities that have continuums of care where people can age in place and have the care and supports that surround them. So it's a really exciting, but we do need to work with all levels of government to try to make it happen. It's not easy. The development cycle is long, and finding zoned land that's appropriate in urban areas is difficult, very difficult to find. So we need to all work together to solve these issues and address the wait lists and create these beautiful caring communities for our seniors, so they can live their best years of their life.
Well, and to your point earlier, in order to care for people, even including in your new homes, you need caregivers, you need people to provide the care. I know that you've been doing some work with the federal government and with some others to bring people into your homes from abroad. What's resonating as you do that outreach to attract international talent? What's the game changer?
Canada was settled by immigration, and we'll continue to depend on immigration and people coming to Canada for work and new opportunity. peopleCare has done a lot of recently, as we're opening new homes, to try to engage with international organizations, such as Talent Beyond Boundaries, a fantastic organization that is connecting refugees with opportunities to work in developing countries like Canada. So, but there's lots of barriers, right? There's lots of barriers to bringing folks from overseas to Canada. But we've stuck with it and worked with some great organizations. I believe for a new home we're opening in Meaford this fall, there are 30 new Canadians going to be coming to Meaford and working. And it's great for the community to see that type of growth in rural Ontario. And certainly the care is needed, but it doesn't end there. We need to continue to create this pipeline of leadership and fantastic talent in our sector, and continue to inspire people into the sector and promote that it is really a great place to work, and it is really satisfying work. And there's really nothing you can do that's more satisfying than caregivers, and we want to find those individuals that are inspired as we are to do that type of work and provide an opportunity to have a great career, with great organizations.
Well, and I know in addition to doing the work that you're doing in terms of attracting international talent, you also have a very innovative partnership with Trent University in Peterborough, Ontario.
Yeah, that's another exciting opportunity because, Canada is a great place for education. People come to Canada from all around the world for education. And really what we should be doing is educating folks for work abroad. Trent is a very forward-looking organization, have a campus, some vacant land in their campus, and had the vision and the idea to build a intergenerational teaching senior living community. peopleCare was selected to work with Trent on this project, and we continue to do that. But it's going to be exciting, basically creating a teaching type of long-term care organization and close to campus and provide intergenerational opportunities. And I think it's a model that could be built to, many other, all communities across Ontario.
What really strikes me, Brent, is you chat, like you're still so full of optimism. It's great to get it into your brain as you think about the opportunities, and you're not constrained to this is my local community, but thinking more broadly, thinking globally, building out on those new partnerships and relationships. So, final question for you. Where do you get your inspiration from?
What gets me out of a bed in the morning, and I believe this is true for many of us at peopleCare, all of us at peopleCare, what gets us up in the morning is changing the world of senior living, and that's what we want to do, and get up every morning and make an impact. And, it really is our focus on continuous improvement, right? Make an impact. Innovation is what inspires me, and adventure of service creation. So, I guess chair of the Long-Term Care Association was an adventure, and maybe that's why I did it. And, continue to be inspired by other development opportunities to make the sector better, senior care sector better. I love working with and getting ideas and sharing, networking with other, leading non-governmental organizations that are doing great work and fostering entrepreneurism and international development. We have the opportunity to make some significant change in the world, and it's just that's really what inspires me and this gets me awake in the morning. So,
well, thank you so much for your commitment to service, your commitment to people, your commitment to excellence and integrity. And thank you for your energy. And we look forward to supporting your work in changing the world.
Thank you, Donna, and thank you for everything that you're doing here and in this podcast. And I know how hard you work, and wow, it's just we're so lucky to have people like you and leaders like you, Donna, in this sector. And please continue doing what you're doing.
Thank you.
Thank you.
Speaking with Brent always fills me with hope for the future. Brent and other leaders across seniors care are moving ahead with new approaches and new partnerships to build high-performing teams and to improve the lives of the people in their care and the lives of their team members. Brent and his teams are leading the changes we all need to see, and the future of seniors care will look very different thanks to their efforts. This week's Coming of Age episode is sponsored by OLTCA's sector champion, Plan A, powered by StaffStat. Does your home have a staffing strategy in place? StaffStat automates your shift filling process and intuitively predicts shift needs. Plan A works in tandem with StaffStat, offering homes a backup staffing model that supports employees and keeps residents safe and cared for. Learn more at jointheateam.com. Thank you for listening to Coming of Age, meeting the needs of our aging population. If you enjoyed this episode, Be sure to subscribe, rate our show 5 stars, and leave us a review on Apple Podcasts. Until next time, I'm your host, Donna Duncan. Keep well.